Hello and welcome on behalf of the Dempsey Center and the Association of Maine Cancer Support Centers, and in honor of National Cancer Survivors Day. Thank you for joining me today, Dr. Dennis. Do you mind introducing yourself?
Sure. So I am Elizabeth Dennis. I'm a general internal medicine physician. I am now working for Northern Light Cancer Care. I am the director of adult cancer survivorship here. This is a new position, and I started in 2019 November. I've been working with cancer care for I'll say I can't do the math quickly, but since 2011, I have been supporting an outreach cancer clinic in Dover Foxcroft, which is now the Northern Light Mayo Hospital. So that's a bit about my professional background.
Awesome, thank you. So can you tell me a little bit more specifics about your role at Northern Light?
Sure. So I came here, like I said, in November 2019. The reason I was brought on was to help the organization develop their cancer survivorship efforts. I thought that maybe they had a few ideas about what they wanted me to do before I got here, but I basically came with a blank slate, which has some positive and some challenges associated with that. But basically, what we're trying to do is recognize that people who have had a history of cancer have unique medical and other needs, psychosocial needs, and we're trying to develop a standard way to recognize and address this. It's been a bit of a journey since I've been here, and I would say what I've accomplished, I hope, several things, but my clinical role right now is that I see people in the context of a one-on-one survivorship visit. And during that visit, I address several things, but I really try to meet people where they are. So when we talk about survivorship, generally it's divided, and again, nothing is black and white in medicine or in life, but acute survivorship is when people are in the phase of diagnosis and treatment. And then extended survivorship is when folks are transitioning out of acute treatment into more of a surveillance or observation phase. And then 5 years and beyond, and again, this is a little bit fluid, but generally, if you're reading about this as a physician or probably as a layperson as well, long-term survivorship is five years and after. So that middle ground is time-wise is a little bit fluid, but that's generally accepted. So you might imagine that people who are 5, 6, 10 years out of having a cancer diagnosis have different needs than someone who is just transitioning out, for instance. So that's what makes survivorship care, I think, unique and very rewarding and challenging, because no two people with a diagnosis of cancer are really created equally. They, I think, have some similar features to their journey, but there are so many variables, which makes it again an opportunity, is how I like to think about it.
First of all, there's the medical side of what is a survivor and how long and what period they're in their survivorship, but then also it's the individual person and what they feel their definition of a survivor is. Exactly. So it is definitely a fluid thing, and we see that every day here at the Dempsey Center. Can you tell me a little bit more about how the needs of patients change from being in active treatment to post-treatment?
Yeah, so mostly I would say mostly what I'm seeing, so this is just my personal professional experience thus far. I'm primarily seeing people in the extended phase of survivorship. So this is sort of that maybe 1 to 5 year And I would say folks in that during that phase are more like, okay, the dust is settling, and yes, I have this diagnosis of cancer. What does that mean moving forward? So how or mostly what I talk about is what tools do people have that they can use to keep themselves well, and perhaps to even decrease their risk of having a cancer recurrence or future cancer. So the focus there is really on what was the cancer that you had, what was the treatment that you had, are you having any residual symptoms of that treatment? Can I help you with that? Are you connected with resources, whether that be in the community or whether you need something a bit more intensive, like a professional, not that the community stuff isn't professional, but like a physical therapist versus a community exercise program, for instance. So most people in that phase are pretty, they have gotten through some of that acute, super scary, holy moly, I was diagnosed with cancer, and they're really trying to move on with their life and thrive. There certainly are people that are still really struggling with their diagnosis of cancer, with residual symptoms at that point. And I love, my preference is to meet people as early as I can in the journey, so they don't have a lot of suffering before they get to a point where they can just sit and have a conversation and say, I'm really still struggling with this. But if I identify those people, I really try to hook them up with whatever support is available. So if we move to more the acute survivor phase, so the transition is really where I'd like to target people, and my group is starting to recognize the importance of that, and you probably are seeing this at the center as well. And when you look at surveys of people who have had cancer, they really identify the transition between acute and extended survivorship as one of being pretty, yikes, what do I do now? So the acute is like, holy moly, I have a history of, I'm a young person or I'm not a young person. I've been diagnosed with cancer. What does that mean? What do I have to do to get through this? And people just kind of put their head down and grit it out. And that, they have a lot of contact with their medical team, generally speaking. And then as they are completing their treatment or have completed their treatment, they are, hey, wow, everything looks great. I'll see you in 3 months. So for the clinician team involved, we're like, woo, woo, we're happy, we're celebrating. But survivors, people that are experiencing this can be a really vulnerable, scary time. So what I am hopeful to do here is really develop standardized processes so people recognize that they're introduced to survivorship earlier in their whole journey of having had cancer. And then they are, as they are making that transition, they recognize that there is some support along the way. It's not just hey, well, everything looks great, and we'll see you in 3 or 4 or 6 or what have you months. And then as we fast forward to the 5+ year survivor, really the focus is on wellness. Again, what are you doing with your diet? How about your physical activity? Are you getting all of your other routine screening that you should be getting? Because you have a history of cancer, but you have a lot of other body parts, and we shouldn't forget about those. And then really looking at treatment. So the farther out people get from treatment, there are some treatments that may put people at risk for other health conditions down the line. So really, asking about symptoms and empowering people so they understand, hey, I want you to look out for this, or if this happens, this is what I'd like you to do. So does that make sense? I hope.
Yeah. No, that's exactly what I need to hear. At the Dempsey Center, we noticed that a lot of people coming in are kind of grasping for some support right after they've finished their treatment, and that can sometimes be the most vulnerable time for them. And so it's really cool to hear that you guys are working on something to kind of make that transition easier for them.
Yes.
Yeah, so that's super exciting to hear. I do have a question. a more specific question. What are some of the more common concerns you get from patients once they come to you, whether it's emotional or physical? What are the most common concerns?
Yeah, that's a great question. It's a big question. It really depends on, um, uh, maybe I'll just back up a little bit. So to highlight, I think the complexity and challenges is, say you're a 20-year-old person diagnosed with cancer, say you're a 70-year-old person diagnosed with cancer. Your concerns may be very different. Perhaps the 70-year-old is concerned about, how can I take care of my grandchild? Or what about my spouse who is failing in his or her health? Whereas a 20-year-old is thinking about employment and fertility and, oh my goodness. So, and then the type of cancer as well. Type of cancer is very different. Breast cancer, for instance, has there are a lot of emotions, understandably. That's just an emotional thing, and just part of who women and men are. Head and neck cancer, folks can have a ton of different problems with that, and they can be a big mix of psychological, so people can be anxious and depressed and have fear of recurrence, physical, problems with body image, or that's not physical, that's more psychological, physical, like pain and problems swallowing and skin changes and all sorts of things. And then sort of the social part can be, such a variety of things, stuff, how do I manage my relationship? What about my kids? I don't feel very employable anymore, or I've been out of employment for a while. So it's just, it's really a whole host of things. And my ideal world is, again, identifying people early so they don't have really, I would love for people to recognize that there's a handoff, that, yep, here I am starting this journey, and I understand what's going to happen next. And I understand there's going to be a different type of support. My team is not abandoning me, but now here's a different type of support. I'm going to be connected with community resources, et cetera. But we're all going to, be with you throughout the course of this journey. Does that answer your question?
And like you said, this work takes a team.
Yes.
It takes a lot of different people in a lot of different positions to really make sure that this person's being supported.
Yes.
Can you tell me a little bit about who else is usually a part of this process and who can provide help and guidance?
Sure. So I can only talk about my personal experience and the work that I'm trying to do here. So the sort of one stop is me at this point, as far as dedicated survivorship services. But within the course of that visit, I really try to sort out what people may benefit for regarding support. So I may get one of our social workers, for instance, involved, and they can help with a whole host of things, solution-focused therapy, getting people connected with therapy in the community. We have a psychiatric nurse practitioner, so if folks are really struggling with anxiety, depression, and they need medication in addition to some type of talk therapy, if you will. We have patient advocates, so if people are struggling with employment, with transportation, with cost of whatever, trying to support people in that way. Dietitians, people have a lot of questions about their diet, and that changes throughout the trajectory. So, when people are being treated, it's more like, holy smokes, everything tastes terrible, and what can I do to just kind of get through this? But then as the dust settles, if you will, perhaps weight loss or weight gain is a concern. So that's a very different conversation. Or if people are doing okay, they oftentimes want to learn, what can I do? What's a healthy diet for me? And so our dietitians can help with that. Physical therapy, we have in our center a lymphedema physical therapist. So that's a very specific type of therapy that a physical therapist can offer. In my perfect world, someday a physical therapist will be involved in all folks who come through, because it's, I think, really important to see where people are in the beginning of their journey as far as their physical stamina and that sort of thing, and how can we keep people as conditioned as possible, not only to help them feel better at that time, but tolerate treatment and then recover better from treatment. So I think those offhand, those are the biggest. Oh, yes, yes. And of course, I didn't even talk about the community cancer support centers, which, oh my goodness, we could talk about the Dempsey Center and all of the wonderful things that happen in the community for a long, long time. But that's also super important that, and I do that all the time, is I say, hey, do you know about all of these things that are available? So really a formal way to connect people to resources. And I talk to people about that 5+ years out, and they're like, really? Gosh, I wish I would have known about this. So I think, getting the word out within the survivor community, as well as in really the medical community, is part of a big part of what I should be doing, among the other things I should be doing.
I know that you do bring kind of a unique perspective to this topic. As an internist, how do you see the role of a primary care physician as a patient ends their active treatment? What can patients do to kind of encourage communication with their primary care? And how does that relationship kind of work once the treatment ends?
Gosh, that's a fantastic question. And again, ideal world is that there would be communication all throughout the patient's treatment course. So my major way of communicating when I'm involved in people's care is by we always create a note as part of our patient encounter. So you go to the doctor has to create a note. It goes into your chart. That note, at the very minimum, should be sent to the patient's primary care doc, so they at least have a high level view of what is going on. And then as people are completing their treatment, ideally, and centers, including our own, have really struggled with this, ideally there would be some sort of treatment summary that was done. So the treatment summary should contain things like, this is the cancer that you had, this is the biology of the cancer, this is the stage, that sort of thing. This was your treatment team. This is the treatment that you had, and possible downstream consequences of said treatment. And then an outline of sort of a roadmap for the next 5 years. Say you're going to be seeing your cancer doctor this often and your breast surgeon this often, and that sort of thing. And then alerting people to, if you have these symptoms, please communicate with your care team. And I pretty generically, ideal world is that, gosh, if I wanted to talk about my ideal world, we would be multidisciplinary from the start. So this would be like, here I am as a person being diagnosed with cancer. I would love to see in a room someday, we'll be in a room together, the medical oncology, so the cancer doctors, whoever that team is, the primary care doctor, and it would be just fantastic that we all discussed people in a multidisciplinary way, so that we would understand or communicate, hey, gosh, if your patient has this problem, you should go to the cancer doctor with that. If you have this problem, you should go to the primary care doctor with that. So I would say that there's research trying to sort this question out, and I would say we don't have many good answers. I'm hoping that at least the basic stuff that's happening is that there's communication with these notes throughout the course of a patient's treatment, and that there's some type of treatment summary that is communicated. But again, that's what we're aiming for initially. But my rosy world is that we would really be multidisciplinary earlier on.
Yeah, that would That would be fantastic. But I mean, just starting with open communication between all parties is a great start. I mean, especially for patients when they're going through this, they are overwhelmed and they can't really, sometimes they just don't have the brain capacity to process what's happening.
Absolutely, yes.
So having these their team communicate with each other and talk about different options and what's happened and what they're going through would be so helpful, I think. And so it's really awesome to hear that that's the kind of work that you guys are doing.
So I'll just back up if I could just add one little thing. This isn't happening well, at least with us. I probably shouldn't say that out loud, but what I would love is, and it's, again, life and people are not black and white. So I would love to be able to tell people, if you have a concern, just call us and have that be a point person. Like navigation is something that you may talk about as your center and as you may be hearing survivors talk about. So ideally we would have a person, if I had a problem, I knew who I could call, and that person could vet my concern and then say, oh gosh, I think that is perfectly reasonable to go see your PCP about, or gosh, yep, come on in. We're going to make you an appointment with either Survivorship. We're going to make an appointment with your cancer doctor, or what have you. That is really what I would love to be aiming for, because like you said, people are overwhelmed, and for them to have to go through this and then navigate their healthcare at the same time, that's a very big ask. So I'm hopeful that we can nudge the medical community into developing a more supportive network.
That's awesome. It's so great to hear, really. And I was curious, as you're working with these patients and they're trying to, manage all of these different appointments and things like that, I'm sure you must interact pretty often with care partners. So partners, spouses, loved ones, other family members. What suggestions do you have for people who are supporting a loved one through a diagnosis? What do you suggest for those people?
Yeah. So I would say coming to appointments is extremely valuable. Having an extra set of eyes and ears, I think, is always fantastic. And I always tell people that, it's never, I always love to have an extra person in the room, because there's only so much a person can comprehend. And it's just not uncommonly just a scary thing to be coming into a facility like ours. Not being afraid to have the advocates advocate. So, if that person if the loved one is concerned about that person, be a squeaky wheel, I tell them. I think that's very important. And getting support for themselves is also incredibly important, because this is, living with a person who has a loved one who has cancer, or not living with them necessarily, but loving a person who has a cancer diagnosis is a whole journey in and of itself that needs, I think, special understanding and support. So those, I think, would be the three major things I think about.
I love to hear that. Yes, that's so important. Well, I mean, that is just a really great background on the work you're doing. I'm so grateful that I got to meet you and talk to you today. Thank you so much for joining me. And for those of you watching at home, thank you so much for watching. Dr. Dennis, do you have any closing statements or anything else you would like to add?
I don't think so. Thank you for the work that you do. I think, again, even though I'm getting older, I still think very idealistically, and I am hopeful that the medical community, so what we do in medicine and what you're doing in the community, we can, just as communication is important between the PCP and the cancer team, I think the communication and joining together with partners just makes so much sense to me. So I look forward to continuing to see what you and your other cancer community support centers, community cancer support centers, I always get that mixed up, are doing. And then hopefully we can all just continue to work together to support this fantastic population.